So glaucoma is a disease of the eye. It specifically affects the optic nerve. So the optic nerve becomes damaged over time. It's associated with increased intraocular pressure in the eye. So the pressure inside of the eye gets higher in some patients, and that causes damage to the optic nerve. Now, that's not always the case. In some patients, the pressure is actually normal, and that pressure is still high enough to cause damage to the optic nerve. There are a few forms of glaucoma. More generally speaking, there's an open angle form where the fluid can flow from the eye easily, but the pressure in the eye is still elevated. And there are narrow angle or closed angle forms of the condition where the fluid has difficulty draining from the openings of the eye. So glaucoma is largely asymptomatic, so it's considered a silent thief of sight. So many people who have glaucoma are actually asymptomatic until the end stages of the disease. So there's not really much to look out for. What people may generally experience is blurring or loss of vision, but that's really in the end stage of the condition. Many patients will be identified as having glaucoma or being a suspect for glaucoma when they attend their usual visit with their optometrist or ophthalmologist. So patients who arrive at the clinic, we evaluate everyone who is in for an annual exam or for other reasons. And one of the things we look for is measuring the intraocular pressure, which gives us a sense of their risk for developing glaucoma. We also look directly at the optic nerve. By observing the optic nerve, we can see if there are changes that may be indicative of early glaucoma. We try to essentially identify the disease in its earliest stage so that we can stop the disease from progressing to the point where someone may lose vision. In terms of prevention, there's not much that can be done outside of being treated if somebody does have glaucoma, and the goal of treatment is really to prevent progression and prevent the disease from getting worse. The biggest thing is that you should go in for your annual eye care visits. Outside of that, it's really challenging for someone to identify or to know if they have any symptoms or signs of glaucoma besides being able to be seen by an eye care professional. If somebody does have a family history of it, it's even that much more significant. In some instances of glaucoma, rarer forms of glaucoma, if you've had trauma to your eye, if somebody plays hockey, been elbowed in the eye, hit in the eye, that trauma can increase the risk of developing glaucoma. And there are some other forms associated with diabetes as well too, particularly in patients who've developed diabetic retinopathy as well. But overall, the major thing to keep in mind is your annual, usual visit for your eye examinations. It's going to be the most important thing for us to identify the condition. I should mention that glaucoma is also associated with aging. So the older you are, the increased likelihood you are developing the most common forms of glaucoma. It tends to happen more in patients over the age of 50, and as you move towards 60, 70, 80, the instances of glaucoma increases then as well. Glaucoma is the second leading cause of blindness in Canada, so it affects about 1 million people who are affected with glaucoma, but half the people who have the condition are totally unaware that they have glaucoma. So again, I emphasize the fact that it's really important to visit your eye care provider regularly to ensure that you don't have a condition like glaucoma. The most difficult thing we have with glaucoma is actually identifying that somebody has a condition. If somebody's in for a visit, then that's much easier. Once glaucoma is identified, most patients require an eye drop to lower the pressure. There are other forms of treatment, which includes laser therapy, which increases the outflow of the fluid in the eye to lower the eye pressure. And for patients who don't respond well to the drops or the laser, or if it's insufficient in lowering the intraocular pressure, then these patients can also have incisional surgery as well. You can always go to our clinic's website or a school's website. We do have some information there and some links that can point patients to other sources for information as well. Or they can always pop into our clinic and we'll be happy to provide them with additional information also.